Our team, welcome back to Plastic Surgery Untold, greatest podcast in the world, as voted by us. One of the most common questions we have is, what type of implants can I choose for my breast augmentation, breast enhancement? And then we'll dive into the pros and cons of them. Let me backtrack a little bit why the United States is super unique and why we've had a little bit of a different journey than outside the United States. In the United States, in 1992, saline implants were the only thing available all the way up until about 2006, unless you're a part of a clinical trial, where they were a great implant. That's what was available. A lot of patients had these, were super happy. A couple of the challenges were the saline implants were much more stiff. This one's already lost a little bit of volume because of the changes. Also a good point. Our body maintains a pretty stable point internally, so the volume stays really nicely in the implants. Not true when it's outside of the body like this, but you can see a couple of the issues. It's the rippling on the edges here. It's basically a water balloon with a really fancy silicone shell stuff, and so that's why they tended to be a little bit firmer. That's why they tended to be a little bit harder. That's why sometimes if you didn't have a lot of breast tissue to begin with, or you had a really big implant, you sometimes could have a really fake stuck-on appearance. Some people liked that upper pole fullness. Some people really liked that over-exaggerated look, and that's completely fine. Everybody's got different preferences, but it was harder to hide that. Thus, most of the breast augmentations, breast enhancement procedures in the United States were done under the muscle, because anything we could do to soften this, to add a layer of insulation, was absolutely key for this. And that's why you saw so much of that. One option, saline implant, gave us a wide variety of implant sizes because the implant came unfilled. So we actually have this fill valve right here. The fill valve is where we would put in injectable saline, same thing you'd get through your IV if you were in the hospital getting an IV therapy, would fill all of this. And so we had a lot of control over the volume. While the envelope came in certain sizes, we could adjust that up or down, and most of the time people were what we'd call overfill that implant, because if you think about it, the more filled, the less rippling. On the flip side, the more firm the implant is, and that's why, especially if our patients want to go a little bit bigger, you could see a wide variety for this. So something to think about in terms of that. As we move along, the really big leap forward was these 5th generation implants. And Sientra was one of the first ones to have a round, smooth 5th generation gummy bear implant. And I'll dive into what a gummy bear implant is on another episode. But gummy bear implants were basically this highly cohesive gel. And in the very beginning, there was this misconception that they only came in shapes. That's not true anymore. And that was one of the big innovations, is that you could have this highly cohesive gel, you could have a great shape. And the benefits of this 5th generation implant were a couple. One, the highly cohesive gel gave you this extra layer of safety, that the gel would stay inside the implant if you ever got a leak, which is extraordinarily rare. 2, and probably more importantly for most of our patients on their weight loss revolution or on the GLP medications or just living your fabulous life, is that it decreased the risk of rippling. And so it gave people a little bit of softness, a lot of fullness, that functional fullness that we're talking about in terms of creating a really nice style for patients, so that you could get that fullness, get the different shapes and sizes. They come in all sorts of sizes, which is absolutely fabulous. So you can get low, moderate, high, and every brand has a little bit of a different, usually 3 or 4 variations in terms of profiles, and then sizes anything from 150s all the way up to 800 cc's. Though that's changing, and we'll talk about that in another episode. Not to give you a bunch of teasers, but can't give it all to you at once. You got to keep coming back. Plastic Surgery Untold, you got to listen to us every week, twice a week. The other idea behind this is that with these implants, it gave the plastic surgeons a lot of control, because you could give somebody a little bit more fullness, not look overly fake. And I think that was absolutely key, to be able to get people into a great spot where they looked great, got them into where they needed to be, but didn't have to look overly fake. You already started to see with these 5th generations more implants in different positions. You saw this in the breast reconstruction world, and it's now come to the aesthetic world. So you saw some behind the muscle, some half under the muscle, and some above the muscle. And we're going to talk more about that with our preservation and some other ideas in terms of that. So 5th generation implant, huge leap forward in terms of breast implant options. Now we've come to our 6th generation implant. With the 6th generation implant, a couple things to think about is they've got different levels of cohesive gel, and most of the breast implant companies do. This is a Motiva implant, this is a Sientra, and then this is actually a Mentor. Allergan has some phenomenal implants as well. They have a wide variety of implant options. With the Motiva 6th generation implant, a couple things to think about is it's got a different progressive gel on the inside. Their gel is different for both the round and ergonomic, and that's one of the things that's really super interesting. The other thing with this 6th generation implant, and I don't know how well you can see it on the video here with me, but it's 100% filled, and so really designed for this Ozempic breast for patients that have lost a lot of weight, maybe a little bit of thinness, so they have that structure from the cohesive gel, still have the softness, and that's really where the 5th generation started it. 6th generation has continued to improve this. How do you make a very cohesive gel that's still extremely soft? And in the old days, that's where some of the early generations of breast implants were a very watery gel because they were trying to be extremely soft. As technology has gotten better, as things have improved, we've been able to merge the best of both worlds. Some of the softness, some of the movement of this, while still keeping that cohesiveness, which decreases your rippling, decreases the gel going anywhere if you did get a leak. So 6th generation implant has a couple really unique things. One, the progressive tension, the progressiveness of the gel, so it flows really nicely with your body, so you got some of that natural fill and move. 2, the implants are 100% filled, which is gonna decrease the rippling. 3, it's got a monoblock technology. What that means in non-fancy terms is that the gel and the shell are all built as one. So you don't have 2 separate entities. And the idea behind that is that everything sticks and flows as one nature. Again, trying to decrease that rippling, keep you in a great spot. And then they've redesigned the shell itself. So it's very strong. It's got this blue seal, so it prevents and helps you identify if there was ever a leak, any type of issue, which is absolutely phenomenal. And then has also been shown with this unique shell to be able to decrease the rate of capsular contracture. I think that's what's been super exciting. It's also given us much more versatility because of the low rate of capsular contracture, which is scar tissue around the implant. We've gotten a lot of versatility in terms of where we put the implant. We're no longer bound by the anatomical markers that we've done in the past. There's some different anatomical architecture that we're going to talk about, especially when we talk about preservation breasts. But in the past, we did a lot of things in surgery to try and hide that implant. We don't necessarily have to do that as much anymore. And so that's why you've seen such this migration towards a above the muscle technique, less destructive to the breast, minimally invasive, much more rapid recovery because of the evolution of the implants. If you think about it, if we're going back to the saline implants, much firmer, much more edges of the implant, while you had a lot of control over the size, while they were super safe, because if you ever got a leak on these, you basically have a flat tire. You'd know you had a leak because one implant would be much smaller than the other. Then the 5th generations made a big leap forward with the cohesive gel. Initially, they were just in shape. Now in a smooth round implant, Sientra really was the first one to do that, and that was absolutely key because really gave a lot of flexibility to your plastic surgeons, gave you as a patient a lot of options for that. And then recently, the 6th generation, while they're only been in the United States for a year, over millions of these implants have been placed worldwide. So not new to the world, just a little bit new to the United States. Actually, have been in clinical trials in the United States for over 7 years, which is a little nugget for you guys that are listening. But the 6th generation has given us even more control because what we want to do, and you hear me talking about custom cleavage, these above the muscle, these preservations, we're limited by the technology and devices that we have. And so now that we have more versatile breast implants, we have more control to really help patients achieve what they're looking for, because I hear so many times patients saying, I just want to improve the overall shape. I really don't want to be any bigger. And before, when we were limited by where we put that implant because of the need for coverage or the need to put it under the muscle, then we were really bound by some of these architectural limits. That's not true anymore. Now we can place the implant in a different position. We can actually use your anatomy to our advantage instead of as a limitation. And then these new implants have done a couple things, especially in the world of Ozempic breast. I think being able to decrease that rippling, giving people some fullness, restoring the volume that they've lost without looking overly big, I think is going to be absolutely priceless for patients. So a couple things to summarize when people talk about what breast implants are available for me and which is best. Going back to salines, I think they're absolutely fabulous still. People still use them. One, you can put these through a tiny incision, which is changing because you're going to be able to do that with some of the other implants as well. 2, you have a lot of control over the size of the implant because we fill it in at the time of surgery. The downsides with the salines is they are a little bit firmer. You are going to see a little bit more rippling with these. Also, 2, the leakage rate is a little higher because we fill these in surgery. Sometimes you get some scar tissue at the valve, and then that leads to a little bit higher rate of implant leakage. So still available, still an option for a lot of patients. As we went to the 5th generation, a lot of patients have these. A lot of patients love these because they're extremely soft. And by not being 100% filled, you do have a little bit more softness, and I think some patients really like that. If you have a lot of breast tissue, you don't have to worry as much about rippling. So this is a great option for a lot of patients, but really was the big first leap forward in terms of the highly cohesive gel, gummy bear implant in a round implant, and really a lot of options for us in terms of that. Remember, right now you can get gummy bear implants in a round. They also also have this ergo, which has a subtle shape to it in terms of things. So a lot of options depending on what you want to do. And then the 6th generation implant is our Motiva Ergo and round. So you actually have both options for this. Again, you have a couple different profile options for that. The 6th generation implant, just to summarize, is 100% filled, more progressive silicone gel to flow nicely with you, but still very cohesive, but soft to give you some of that functional fullness. The monoblock technology, where it sticks, the implant and the gel all stick together. And then lastly, this unique shell that helps decrease the rate of capsular contracture. It's really been cool to see the evolution, even my short career, of how much this has improved. And if you think about it in other technology, computers, iPhones, you're gonna see that progressively getting better. Super excited to share with you guys. Breast implants explained. We'll see you guys soon. Bye.